In the winter of 1873, a terrified nurse at the prestigious Deseret Medical Institute in Salt Lake City, Utah, documented a horrifying discovery that would haunt American medical history for generations. Hidden within a secluded ward of the hospital, she found 56 patients lying motionless in their beds, their eyes following her every movement, despite their bodies remaining completely paralyzed. The medical files revealed they had all undergone an experimental procedure performed by the brilliant but ruthless Dr. Elijah Blackwood, whose revolutionary surgical technique had generated over $150,000 in fees from wealthy patients seeking cures for various ailments, a sum worth nearly $3.5 million today. The Blackwood Method had transformed a respected medical institution into a living nightmare for dozens of victims, trapped in their own bodies. Before we continue with the story of Dr. Blackwood and his catastrophic medical innovation, I want you to know that this channel is dedicated to bringing you the most chilling true stories from America's dark medical past. Hit that subscribe button and ring the notification bell so you never miss these exclusive tales. And tell me in the comments, what state are you listening from? I love hearing from our community of history seekers across the country. Now, let's discover how a celebrated physician became the architect of one of history's most horrific medical disasters. The Deseret Medical Institute stood as a monument to scientific progress amid the rugged landscape of the Utah Territory. Founded in 1865 by the visionary surgeon Dr. Elijah Blackwood, the institution had quickly earned a reputation as one of the West's premier medical facilities. The impressive three-story sandstone building with its distinctive octagonal tower was specifically designed to pioneer new treatments for nervous system disorders that plagued frontier settlers who suffered injuries in mining accidents, railway construction, and the harsh conditions of Western expansion. Dr. Elijah Blackwood, the Institute's founder and chief surgeon, was a commanding figure in American medicine. Standing over 6 feet tall with piercing gray eyes and a meticulously groomed dark beard streaked with silver, he commanded instant respect from colleagues and patients alike. Born in Boston to a family of respected physicians, Blackwood had studied at Harvard Medical School before serving as a surgeon during the Civil War, where he developed revolutionary techniques for treating battlefield injuries to the spine and nervous system. The horrors Blackwood witnessed on the battlefield had transformed him, igniting an obsession with finding ways to repair damaged nerves and restore movement to paralyzed limbs. After the war, he had traveled to Vienna, Paris, and Edinburgh to study with Europe's finest neurologists before establishing his institute in the Utah Territory, where he believed the isolation would allow him to pursue his research without the constraints of established medical orthodoxy. Dr. Catherine Miller served as the Institute's assistant director and Blackwood's most trusted colleague. A rare female physician in an era when women medicine faced extreme prejudice, Miller had earned her medical degree in Philadelphia before joining Blackwood in his Western venture. Her delicate features and warm demeanor often put patients at ease, providing a compassionate counterbalance to Blackwood's intense, sometimes intimidating presence. Miller specialized in the administration of anesthetics and post-surgical care, making her an essential partner in Blackwood's increasingly ambitious surgical procedures. The third member of the Institute's leadership was Dr. Samuel Harrison, who served as the Chief of Research and Laboratory Sciences. Where Blackwood was charismatic and Miller was compassionate, Harrison was methodical and precise. His thin frame, spectacles, and perpetually ink-stained fingers reflected his academic nature. Harrison had studied chemistry and biology in Germany before joining the Institute, bringing with him knowledge of the latest European advancements in medical science. His laboratory on the Institute's ground floor was filled with exotic chemicals, preservation fluids, and experimental compounds that he had either imported from Europe or created himself. The Deseret Medical Institute attracted patients from across the American West and even the eastern states, particularly those suffering from paralysis, chronic pain, and nervous disorders that conventional medicine had failed to treat. The Institute's reputation for innovation drew desperate individuals seeking relief from conditions that had left them disabled or in constant agony. Many were wealthy individuals who had exhausted all other medical options and were willing to pay extraordinary sums for Blackwood's experimental treatments. The Institute's sprawling grounds included not only the main hospital building but also comfortable residential cottages where recovering patients could stay during long-term treatment, gardens designed to provide a healing environment, and even a small chapel where patients and their families could pray for successful outcomes. Local residents in Salt Lake City had welcomed the Institute as both a medical resource and an economic boon to the growing frontier city. Dr. Blackwood had cultivated relationships with local business leaders and politicians, often providing free treatment to prominent citizens and their families. He delivered lectures at community gatherings about the importance of modern medicine and scientific progress, positioning himself as a visionary bringing the latest advancements to the Western frontier. His charitable foundation provided basic medical care to poor families in the region, further enhancing his reputation as a benefactor to the community. However, beneath this veneer of medical innovation and community service, something far more disturbing was developing within the walls of the Deseret Medical Institute. Blackwood's obsession with nervous system restoration had led him down an increasingly dangerous path of experimentation, one that would ultimately transform his healing mission into something monstrous. The first indications that something was amiss at the Deseret Medical Institute emerged in the spring of 1870, when Blackwood began to speak excitedly about a breakthrough in the treatment of spinal injuries. During a private dinner with his colleagues, Miller and Harrison, Blackwood revealed that he had developed a new surgical approach that could potentially preserve nerve function even in severely damaged spinal cords. He called his innovation neural preservation therapy and claimed it represented a fundamental advance in the treatment of paralysis. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. The key, Blackwood explained to his colleagues, is not in repairing damaged nerves, but in preserving the connections that remain and preventing the body's own inflammatory response from causing further damage. He described a complex procedure involving the injection of a special compound directly into the spinal fluid, followed by precise surgical manipulation of the vertebrae to relieve pressure on the spinal cord. Dr. Miller expressed concern about the risks involved. Elijah, the spinal cord is extraordinarily delicate. The slightest error could cause permanent damage. Blackwood dismissed her worries, insisting that he had performed the procedure successfully on laboratory animals and was confident it could be adapted for human patients. Dr. Harrison was more supportive, noting that their institute had been founded specifically to pursue bold new treatments that mainstream medicine was too cautious to attempt. If we limit ourselves to established procedures, we might as well close our doors and send our patients back to suffer, he argued. The first human trial of Blackwood's neural preservation therapy took place in July 1870. The patient was Jonathan Wheeler, a 42-year-old railway foreman who had suffered a severe spinal injury when a loaded cargo wagon had overturned, crushing his lower back. Wheeler had been told by doctors in Denver that he would never walk again and had traveled to the Deseret Institute as his last hope. Blackwood personally explained the experimental nature of the procedure to Wheeler, emphasizing that while it carried significant risks, it also offered the only possible chance of recovery. Wheeler, facing a lifetime of paralysis, readily consented to become the first recipient of the Blackwood Method, as it would later be called. The surgery took place in the Institute's main operating theater, with Dr. Miller administering the anesthesia and Dr. Harrison preparing the special compound that would be injected into Wheeler's spinal fluid. The procedure lasted over 7 hours, with Blackwood working with extraordinary precision to expose the damaged portion of Wheeler's spine, inject his compound at multiple points along the spinal column, and then perform minute adjustments to the vertebrae. When Wheeler regained consciousness 2 days later, the initial results seemed promising. He reported increased sensation in his legs, which had been completely numb before the surgery. Blackwood was elated, declaring to his colleagues that they were on the verge of a medical revolution. Over the following weeks, Wheeler showed slight improvements in mobility, eventually regaining the ability to move his toes and slightly flex his ankles. What neither Wheeler nor the medical staff initially realized was that these improvements came at a terrible cost. 3 weeks after the surgery, Wheeler began to experience excruciating headaches and episodes of muscle spasms throughout his body. Dr. Miller prescribed various pain medications, but nothing seemed to provide lasting relief. More disturbing, Wheeler began to report strange sensations, feeling as though insects were crawling beneath his skin, or that his limbs were burning from the inside. Despite these concerning symptoms, Blackwood was eager to proceed with additional patients. The modest improvement in Wheeler's condition was enough to convince him that his method had merit, and he was determined to refine the procedure through further trials. Over the next 6 months, 7 more patients with spinal injuries underwent variations of the Blackwood method, each receiving slightly different formulations of the spinal injection or modified surgical techniques. The results were inconsistent. Some patients showed minor improvements similar to Wheeler's, while others experienced no benefit at all. However, all of them eventually developed the same disturbing side effects: severe headaches, muscle spasms, and bizarre sensory disturbances. 2 patients also began experiencing periodic episodes of complete paralysis that would last for hours before suddenly resolving. Dr. Miller became increasingly concerned about these side effects and urged Blackwood to suspend the procedures until they better understood what was happening. These symptoms suggest the compound is affecting the nervous system in ways we don't understand, she argued during a tense meeting in February 1871. We could be causing permanent damage. Blackwood was unmoved. All innovative treatments involve risk and unexpected outcomes, he countered. If Pasteur and Koch had abandoned their work at the first sign of complications, where would medical science be today? We must persevere to perfect the method. Dr. Harrison supported Blackwood, noting that the compound could be refined to reduce side effects while preserving its therapeutic benefits. He proposed a series of laboratory experiments to test modified formulations before using them on additional patients. During this period, the nature of Blackwood's compound remained a closely guarded secret. Only he and Harrison knew its exact composition, though Miller was involved in its administration. What we now know, based on records discovered years later, is that the compound contained a complex mixture of chemicals including mercury derivatives, phosphorus compounds, and extracts from various plant sources including belladonna and curare. Some of these ingredients were known to affect nerve transmission, while others had been selected based on Blackwood's unique theories about nervous system function. The turning point came in August 1871, when Blackwood treated Sarah Langford, the 24-year-old daughter of a wealthy mining magnate from Colorado. Sarah had suffered partial paralysis following a riding accident and had been brought to the institute by her father, who was willing to pay any price for her recovery. The procedure appeared initially successful, with Sarah regaining some movement in her affected limbs within days of the surgery. However, on the 10th day of her recovery, Sarah experienced a terrifying episode. While being examined by Dr. Miller, she suddenly found herself unable to move or speak, though she remained fully conscious. Her eyes, the only part of her body she could control, showed clear panic. Miller immediately summoned Blackwood, who observed the phenomenon with scientific interest rather than medical concern. Fascinating, he noted, examining Sarah's eyes. Closely, she's clearly conscious and aware. Pupillary response is normal. This suggests the compound has affected motor pathways while sparing sensory and cognitive functions. After approximately 3 hours, Sarah suddenly regained her ability to move and speak. She described the experience as being buried alive. Inside my own body, aware of everything happening around her, but completely unable to respond. The episode left her deeply traumatized, and she begged to be spared from any further treatments. Rather than being alarmed by this development, Blackwood became intrigued by the selective paralysis that preserved consciousness. He began to theorize that this effect, if properly controlled, might have applications beyond treating spinal injuries. In his private journal, which would later be discovered during the investigation, he wrote, "Today's event with patient SL suggests possibilities I had not previously considered. The ability to immobilize a patient while maintaining consciousness could revolutionize certain surgical procedures where general anesthesia poses excessive risk." This marked the beginning of a dark new direction in Blackwood's research. While continuing to present his work publicly as a treatment for paralysis, he began privately exploring the potential of his compound as what he called a conscious immobilization agent. He believed such an agent would allow surgeons to perform procedures on patients who could report sensations and symptoms during the operation, but would remain perfectly still without the risks associated with complete anesthesia. Dr. Harrison eagerly supported this new direction, seeing potential applications for battlefield medicine and emergency surgeries. Dr. Miller, however, was horrified by the implications. "You're talking about deliberately creating the very state that terrified Miss Langford," she confronted Blackwood. "A state she described as torture. How can you possibly consider inducing this condition intentionally?" Blackwood's response revealed how far his ethical boundaries had shifted. "Every medical advance requires sacrifice," he told her coldly. "Ether and chloroform weren't developed without patient suffering. The temporary discomfort of a few patients is a small price to pay for a tool that could save countless lives." The disagreement created a growing rift between Miller and her colleagues. She began keeping her own separate records of patients' symptoms and responses, documenting the increasingly troubling patterns she observed. Meanwhile, Blackwood and Harrison continued refining the formula, testing various modifications on unwitting patients who had come to the Institute seeking treatment for paralysis or chronic pain. By early 1872, Blackwood had developed what he considered an improved version of his compound. This new formulation, he claimed, would provide the benefits of his neural preservation therapy while minimizing the side effects that had plagued earlier patients. In reality, he had specifically engineered the compound to reliably produce the state of conscious paralysis that Sarah Langford had experienced, while making it last longer and take effect more quickly. The first intentional use of the compound as a conscious immobilization agent occurred in March 1872. The patient was Michael Donovan, a 38-year-old miner who had developed a tumor near his liver. Blackwood explained to Donovan that he would be given a special medication that would keep him still during surgery while allowing him to remain awake, claiming this would be safer than general anesthesia given Donovan's weakened condition. What Blackwood did not explain was that Donovan would be completely paralyzed yet fully aware during the entire excruciating procedure. When the compound took effect and Donovan realized he could not move or speak as the surgeon's knife cut into his abdomen, his eyes reflected pure terror. Dr. Miller, who was present but had not been told of Blackwood's true intentions, was horrified to realize what was happening. "He can feel everything," she whispered in shock, noting the tears streaming from Donovan's frozen eyes. "For God's sake, Elijah, give him ether immediately." Blackwood refused, calmly continuing the operation while instructing Harrison to note Donovan's pupillary responses as indicators of pain levels. "This is a medical breakthrough in action, Catherine," he responded. "Mr. Donovan is providing invaluable service to medical science." The surgery lasted over 2 hours, during which Donovan remained completely paralyzed and fully conscious, experiencing every moment of the operation without any pain relief. When the compound finally began to wear off, his first sounds were not words, but agonized screams that echoed throughout the institute. This horrific event should have been the end of Blackwood's experiments, but instead, it marked the beginning of an even darker phase. Dr. Miller, deeply traumatized by what she had witnessed, threatened to report Blackwood to medical authorities and the territorial government. Before she could act, however, she was found unconscious in her office, apparently having suffered a stroke. She was confined to the institute's private ward, where Blackwood personally supervised her care and ensured she had no contact with the outside world. With Miller effectively silenced, Blackwood and Harrison accelerated their use of the compound, now referring to it in their private communications as conscious paralytic serum, or CPS. They began selecting patients not for their medical needs, but for their suitability as test subjects. Individuals who were unlikely to be missed, travelers passing through the territory, immigrants without family connections, and people estranged from their relatives were identified as ideal candidates. These unwitting subjects were admitted to the institute under various pretexts: minor surgeries, treatments for pain, or evaluations for nervous conditions. Once isolated in the private ward, they were administered the CPS without their knowledge or consent. Many were kept in this state of conscious paralysis for days or even weeks as Blackwood and Harrison documented the compound's effects and tested various modifications to the formula. What these patients experience can only be described as torture. Fully conscious yet unable to move or communicate, they endured not only the terror of complete immobility, but also the routine discomforts and indignities of being treated as inanimate objects. Bedsores developed on patients left in the same position for too long. Hunger and thirst became agonizing when feeding was delayed. The simplest bodily needs became sources of humiliation when attended to by orderlies who believed the patients were unconscious. Most horrifying of all was the isolation. Unable to signal their awareness, many patients were discussed as objects in their presence. They listened as Blackwood and Harrison debated their cases in clinical terms, sometimes speculating about how long they might survive in their paralyzed state or whether their organs might be useful for anatomical study after death. The human mind is not designed to endure such conditions. Many victims later reported experiencing hallucinations or dissociative states as their minds sought escape from the unendurable reality of their situation. Some described feeling as though they were floating above their bodies, while others experienced vivid waking nightmares that blended with the actual horrors of their circumstances. By autumn of 1872, Blackwood had refined his techniques to maintain patients in this state of living death for extended periods. The private ward of the institute now contained over 24 victims, all fully conscious but completely paralyzed, their only means of expression the movement of their eyes. Blackwood's journal entries from this period reveal not concern for his victims' suffering, but excitement about the scientific possibilities. Subject 17 has now been maintained in the immobilized state for 31 days. He wrote in October 1872, "Remarkable preservation of cognitive function is evident from pupillary responses to verbal stimuli. This suggests the compound affects only motor pathways while sparing higher brain functions. The potential applications for prolonged surgical procedures or treatment of violent mental patients are extraordinary." Dr. Harrison's laboratory had become a factory for producing the CPS in larger quantities. Shipments of exotic chemicals arrived regularly from suppliers in Europe and the eastern United States, ostensibly for legitimate medical purposes. Harrison had also begun experimenting with methods to administer the compound more efficiently, developing techniques for slow, continuous infusion that could maintain the paralytic state indefinitely. The financial aspects of the operation were equally calculated. While some victims were selected specifically for their isolation, others were wealthy patients whose families paid substantial sums for specialized long-term care. Blackwood would inform these families that their loved ones required an innovative therapy that might take months to show results, collecting thousands of dollars in fees while the patients lay paralyzed in the private ward, silently witnessing their own exploitation. By December 1872, the private ward contained 36 patients in various stages of paralysis. Some had been in this state for over 6 months, their bodies beginning to show signs of severe muscular atrophy, while their minds remained terrifyingly alert. The institute had been transformed from a place of healing to a chamber of horrors, with only a small circle of trusted staff allowed access to the private ward. During this period, rumors began to circulate in Salt Lake City about strange practices at the Deseret Medical Institute. Local residents reported hearing unexplained moaning sounds coming from the institute at night. Several families who had sent relatives to the institute for treatment reported being denied visits or receiving only vague updates about their loved ones' conditions. A few former employees had left abruptly, refusing to discuss their reasons, but warning others not to seek employment there. These rumors might have led to an earlier investigation if not for Blackwood's careful cultivation of relationships with local authorities. The territorial marshal, whose wife had received free treatment for migraines at the institute, dismissed the stories as competitors trying to damage Blackwood's reputation. The mayor, who had invested in the institute's expansion, publicly praised Blackwood as a pioneer bringing modern medicine to the frontier. And as more patients were admitted to the private ward, more families found themselves unable to obtain clear information. Letters to patients went unanswered. Requests for visits were denied with explanations about critical stages of treatment or risk of infection. Some families who traveled to Salt Lake City were turned away at the institute's gates, told that their loved ones were undergoing procedures that could not be interrupted. The situation might have continued indefinitely if not for the arrival of Emily Winters, a young nurse who had trained in Chicago and had come west seeking adventure and professional opportunity. Hired in January 1873 to assist with general patient care, Emily was initially impressed by the institute's modern facilities and Blackwood's reputation for innovation. During her first weeks, she was assigned to the main wards, caring for patients recovering from conventional surgeries or receiving treatments for various ailments. The mystery of the private ward, however, quickly captured her curiosity. Staff spoke of it in hushed tones, and only certain doctors and nurses were allowed access. When Emily asked about the patients there, she received evasive answers about special cases and experimental treatments. One older nurse warned her simply, "Don't ask questions about the private ward if you want to keep your position." Rather than discouraging her, these warnings only heightened Emily's concern. She began observing the comings and goings from the private ward, noting which staff members had access and when supplies were delivered. She noticed that despite housing supposedly unconscious or severely ill patients, the ward received far fewer medical supplies than would be expected, but large quantities of an unusual solution that was stored in a special refrigerated cabinet. Emily's opportunity to discover the truth came in February 1873, when a winter storm prevented several staff members from reaching the institute. Faced with a shortage of personnel, the head nurse assigned Emily to assist with morning care in the private ward, giving her strict instructions about which tasks to perform and warning her not to disturb Dr. Blackwood's special research subjects. What Emily discovered when she entered the private ward would haunt her for the rest of her life. 2 rows of beds lined the long room, each occupied by a patient who appeared to be in a comatose state. As she moved from bed to bed, however, she noticed something disturbing. Many of the patients' eyes were open, and they seemed to be following her movements. When she approached the first bed to check the patient's vital signs, she was startled to see tears forming in the woman's eyes. Emily instinctively spoke to her, asking if she was in pain. The woman's eyes widened, and more tears flowed, but she made no sound or movement. Moving to the next bed, Emily observed the same alert gaze in an elderly man whose chart indicated he had been unconscious for over 3 months. As the horrible truth dawned on her, Emily began to whisper to each patient, watching their eyes for responses. Some blinked deliberately when she asked questions, while others wept silently. All showed clear signs of consciousness despite being completely immobile. The final confirmation came when she pretended to leave the ward, then quietly returned to find many of the patients had closed their eyes, only to open them again when they heard her approach, a simple but unmistakable act of volition. Emily's discovery in the private ward left her shaking with horror and disbelief. She forced herself to maintain her composure as she completed her assigned tasks, all while making mental notes of each patient's condition and the details written on their charts. As soon as her shift ended, she retreated to her small room in the nurse's quarters and began documenting everything she had observed. The magnitude of what she had uncovered was almost too terrible to comprehend. 56 patients trapped in a state of living death, fully aware but unable to communicate. Their suffering to anyone except through the desperate movement of their eyes. That evening, as snow continued to fall across Salt Lake City, Emily made the decision that would change the course of medical history and her own life forever. She would gather evidence, create a detailed record of Blackwood's atrocities, and then bring that evidence to authorities outside the territory who could not be influenced by Blackwood's local connections. The risk was enormous. If discovered, she would likely become Blackwood's next victim, but the alternative of allowing the suffering to continue was unthinkable. Over the next 3 weeks, Emily undertook a dangerous campaign of covert investigation. She volunteered for additional shifts in the private ward, slowly gaining the trust of the regular staff while secretly communicating with patients through eye movements and whispered questions that required only blinks for yes or no answers. Through these painstaking interactions, she learned that many patients had been conscious for months, experiencing every moment of their imprisonment in motionless bodies. Emily discovered the locked cabinet where Blackwood kept his case files, and during a night shift when the supervising nurse was called away to an emergency, she managed to pick the lock using skills she had learned from her locksmith father. The files contained detailed records of each patient's treatment, including precise formulations of the conscious paralytic serum and Blackwood's clinical observations of its effects. Most disturbing were his notes on the psychological deterioration he observed in long-term subjects, which he documented with the detached interest of a naturalist studying insects. Subject 23 exhibits signs of severe psychological distress after 112 days of immobilization. One entry read: pupillary dilation, excessive lacrimation, and rapid eye movement during verbal stimuli suggesting distress. Particularly notable reaction when family inquiries are mentioned in her presence. Consider reducing auditory stimulation to prevent further psychological deterioration and extend useful observation period. The files also revealed the full scope of Blackwood's operation. He had administered the CPS to 86 patients over the previous 2 years. Of these, 17 had died while paralyzed, most from respiratory complications or infections. Another 13 had been terminated when they began showing signs of physical deterioration that would make them unsuitable for further study. The remaining 56 were currently maintained in the private ward, with the longest surviving subject having been paralyzed for over 14 months. Most shocking was Blackwood's long-term vision, outlined in a proposal he had drafted for potential investors. He planned to establish a network of specialized facilities across the Western Territories, each housing up to 100 research subjects, maintained in a state of conscious paralysis. These facilities would serve multiple purposes: training centers, where medical students could practice surgical techniques on paralyzed but living patients, research laboratories for testing new drugs and procedures, and long-term care facilities for wealthy families seeking to maintain relatives in a state of suspended animation during treatment for otherwise terminal conditions. The financial projections were staggering. Blackwood estimated annual revenue of over $500,000 from a network of 5 facilities, with expenses kept minimal by the reduced care requirements of paralyzed patients. He had already begun discussions with potential investors in San Francisco and Denver, presenting the concept as a revolutionary approach to medical research and education. Emily also discovered correspondence between Blackwood and Dr. Harrison regarding the refinement of the CPS formula. They had developed 7 distinct variations, each producing slightly different effects. Some were designed for rapid onset, but shorter duration, intended for surgical procedures. Others were formulated for long-term maintenance of paralysis, with additional compounds to prevent muscle atrophy and tissue breakdown. The most disturbing variant was designed to allow selective recovery of speech while maintaining full-body paralysis, allowing subjects to answer questions during experiments without being able to cry out or resist. Armed with this evidence, Emily faced the challenge of getting it to authorities who would act on it rather than alert Blackwood. The territorial government was unlikely to intervene given Blackwood's connections, and local law enforcement had already dismissed previous concerns about the institute. She needed to reach federal authorities or respected medical institutions in the East who would recognize the atrocity for what it was. The opportunity came when Emily learned that a federal marshal, William Thorne, would be passing through Salt Lake City on his way to San Francisco. Marshal Thorne had a reputation for incorruptibility and had previously investigated medical fraud cases in Colorado. Emily arranged to meet him secretly at a boarding house on the outskirts of town, bringing with her copies of Blackwood's records and her own detailed observations. The meeting nearly ended in disaster when one of Blackwood's orderlies spotted Emily entering the boarding house. By chance, he had been delivering medicine to another resident and recognized the nurse immediately. Suspicious of her presence in a neighborhood far from the institute, he lingered outside, watching through windows as Emily handed documents to a man he didn't recognize but whose formal attire suggested official authority. The orderly rushed back to the institute to inform Blackwood, who immediately understood the threat. He summoned Harrison and 3 trusted staff members to his office, where he outlined a plan to deal with the security breach. Emily would be detained upon her return to the institute, administered the CPS, and added to the private ward as Subject 87. Meanwhile, they would need to accelerate their timetable for relocating the operation to a more remote facility in Wyoming Territory, a move Blackwood had been planning as a precaution against growing local suspicions. Emily returned to the institute unaware of the danger awaiting her. She had arranged to meet Marshal Thorne again the following day after he had reviewed the evidence, and she intended to continue her normal duties to avoid arousing suspicion. As she entered the nurse's quarters, however, she was immediately summoned to Blackwood's office for what was described as an urgent consultation about a patient. The moment she entered the office and saw Harrison preparing a syringe, Emily realized she had been discovered. She turned to flee, but 2 orderlies blocked the door. Blackwood's voice was unnervingly calm as he explained what was about to happen. "Nurse Winters, your curiosity has created a regrettable situation. However, you will soon have the unique opportunity to experience our work firsthand. The formula has been modified recently. I'm quite interested to observe its effects on someone of your intelligence and medical training. Your observations, communicated through our established eye movement protocol, will be invaluable to our research." What Blackwood could not have known was that Marshal Thorne, concerned by the gravity of Emily's allegations, had not waited until the next day to act. After reviewing the evidence for just 1 hour, he had assembled a team of deputies and was already approaching the Institute with warrants for Blackwood's arrest and the seizure of all medical records. As Harrison approached with the syringe, the sound of multiple horses and wagons arriving at the Institute gates distracted everyone in the room. Seizing the moment, Emily knocked the syringe from Harrison's hand and managed to escape the office. She ran through the corridors shouting for help, alerting patients and staff to the approaching authorities and the horrors in the private ward. The chaotic scene that followed would be recounted in newspapers across the country in the coming weeks. Marshal Thorne and his deputies entered the Institute to find staff members fleeing in all directions, some trying to destroy records while others, learning the truth for the first time, were attempting to help patients. Blackwood barricaded himself in the laboratory with Harrison, desperately trying to destroy evidence by setting fire to patient files and research notes. The most dramatic moment came when Thorne and his men finally gained access to the private ward. The sight of 56 patients lying motionless in their beds, their eyes frantically moving to communicate their consciousness, was unlike anything the lawmen had ever encountered. Emily quickly explained how to recognize signs of awareness in the patients, and the marshal's report would later describe the moment with stark simplicity. The horror was not in what we could see, but in what the victims' eyes told us they had endured. Blackwood and Harrison were eventually captured attempting to flee through a service tunnel that led from the laboratory to a stable behind the Institute. Both men were found carrying substantial cash, false identification papers, and tickets for a steamship departing from San Francisco to Hong Kong. They also carried small vials of the CPS, possibly intended for use on anyone who attempted to detain them during their escape. The immediate challenge facing Marshal Thorne and local authorities was the care of the 56 paralyzed patients. No one knew how to reverse the effects of the CPS, and the victims remained fully conscious, but unable to move or communicate beyond eye movements. Emily organized the nursing staff to provide comfort measures while telegrams were sent to medical experts across the country seeking advice on potential treatments. The first breakthrough came from an unlikely source. Dr. Catherine Miller, who had been kept isolated in a small room off the private ward after her supposed stroke, was discovered by deputies searching the Institute. Though weakened from months of being drugged to keep her compliant, she was able to provide crucial information about the CPS formula and potential antidotes that Harrison had developed but never used. Blackwood considered the paralysis irreversible. After approximately 3 weeks of continuous administration, she explained from her hospital bed. But Harrison created an antagonist compound as a precaution in case they accidentally exposed themselves to the serum. I saw the formula in his notes. I believe I can recreate it if given access to a proper laboratory. With Dr. Miller's guidance, a team of pharmacists and physicians from Salt Lake City and nearby military posts worked around the clock to produce the antagonist compound. The first test subject was William Carroll, a 34-year-old rancher who had been paralyzed for just under 2 months after seeking treatment for a back injury. The administration of the antidote was a tense affair, with no guarantee it would work and significant risk of adverse reactions. For nearly an hour after receiving the compound, Carroll showed no response. Then suddenly, his right index finger twitched. Within minutes, he was able to move his hand, then his arm. The recovery of movement spread gradually through his body. Over the next several hours, accompanied by excruciating pain as sensation returned to muscles that had been immobile for weeks. His first words, spoken in a hoarse whisper after nearly 8 weeks of silence, were simply, "Water, please." "Then let me tell you what hell is like." The antagonist proved effective for most patients who had been paralyzed for less than 6 months. Recovery was slower and less complete for those who had been immobilized longer, with many experiencing permanent neurological damage. Tragically, for 11 patients who had been maintained in a paralyzed state for over a year, the treatment failed entirely. Their consciousness remained intact, but their bodies never regained the ability to move voluntarily. They would require lifelong care, forever dependent on others while fully aware of their condition. The trial of Elijah Blackwood and Samuel Harrison began in June 1873 and became one of the most sensational criminal proceedings in American medical history. The courtroom in Salt Lake City was packed daily with journalists, medical professionals, and family members of victims. The evidence presented was so disturbing that several jurors requested to be excused, unable to bear the testimony of recovered victims who described their experiences. William Carroll's testimony was particularly powerful. He described the moment he realized he could not move, but was fully conscious. "I thought at first I was having a nightmare. I tried to scream, but nothing happened. Then I saw Dr. Blackwood leaning over me, checking my eyes with a light. He said to the nurse, 'Excellent response. Full consciousness with complete motor paralysis.' That's when I knew this was real, and it was being done to me deliberately." Carroll went on to describe the psychological torment of his imprisonment. "Every minute lasted an eternity. I counted seconds to stay sane. I would count to 60 over and over, trying to track the hours. I listened to every sound, trying to orient myself to day and night. The worst was when my wife came to visit, and Blackwood told her I was unconscious and unlikely to recover. She wept by my bedside while I screamed inside my mind, trying desperately to move just one finger to let her know I was there." Other survivors shared similar accounts. Sarah Jenkins, a schoolteacher who had been paralyzed for 3 months, described how staff would discuss her case as though she were an object. They would say things like, "This one's kidney function is declining," or "Check if this one still responds to pain stimuli." Never she or Miss Jenkins, always this one, or Subject 42. They knew we could hear them. Sometimes I think they enjoyed reminding us that we had become things, not people. The most damning evidence came from Blackwood's own journals and research notes, which detailed his progressive dehumanization of his victims and his excitement at the power his discovery gave him. One entry, read aloud in court, revealed the depth of his moral corruption. "There is something transcendent about observing a mind trapped in perfect stillness. Like a god, I decide when they move, speak, or remain frozen in time." Subject 29 has developed an interesting response to prolonged immobilization. Her eyes now follow me with what I can only describe as worship. After 3 months of total dependence, she seems to have accepted me as the arbiter of her existence. This psychological adaptation merits further study. Blackwood's defense was as disturbing as his crimes. Rather than denying his actions, he justified them as necessary for medical progress. Taking the stand in his own defense, he argued that throughout history, medical breakthroughs had required sacrifice and that his work would ultimately benefit humanity through advancements in anesthesia and neurological treatment. "Every major medical advance has come at a cost," he told the shocked courtroom. "When the first surgeons began using ether and chloroform, patients died. When the first vaccines were developed, test subjects suffered. My methods may seem harsh to the layman, but future generations will recognize that I pushed the boundaries of medicine forward. These subjects served a greater purpose than they ever could have in their ordinary lives." This argument only deepened public outrage. The prosecutor's response became famous in legal circles. "Dr. Frankenstein had a purpose too, ladies and gentlemen of the jury. But we remember him as a monster, not a pioneer." The jury deliberated for less than 3 hours before returning guilty verdicts on all counts for both Blackwood and Harrison. The judge calling their crimes an abomination that offends God and man alike, sentenced both men to death by hanging. The execution, carried out on October 17, 1873, was attended by hundreds of spectators, including many family members of victims who had traveled across the country to witness justice being served. But the story of the Blackwood Method did not end with the execution of its creators. The aftermath of the case would transform American medicine and the legal protections for patients in ways that continue to influence healthcare today. If you find this story disturbing, you're not alone. The Blackwood case shook America's faith in medical institutions and led to reforms that protect patients to this day. Hit that like button if you appreciate learning about these hidden chapters of medical history, and subscribe to hear more stories about the dark events that shaped our modern healthcare system. I'm always amazed by how many of you comment that you never learned about these crucial historical events in school. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.